Choosing the wrong Medicare supplemental plan can cost you tens of thousands of dollars over the course of your lifetime. Oftentimes, people are told just choose Plan G or just choose the cheapest Medicare supplemental plan when they don't understand how the insurance pricing models work or how rate increases work. Choosing the wrong supplemental plan at age 65 can subject you to medical underwriting when it's time to change, and medical underwriting is not guaranteed. So let's get into how Original Medicare works with Medicare supplemental plans and some of the differences in the actual plan choices that you have. So again, with Original Medicare is made up of two parts, right? Part A and Part B. So Part A is going to cover your inpatient hospital care, skilled nursing, hospice, all the inpatient services. And again, the Part B, that's going to cover the outpatient expenses, doctor visits, preventative care, all the services you do on an outpatient basis, as well as the physician services. Okay, we'll get into the costs for each of these. And again, it's important to remember that Original Medicare doesn't cover prescription drugs. You can pick up a secondary prescription drug plan from an insurance company that offers these Part D plans as well. But if you end up getting a Medicare supplement, the prescription drug coverage, again, is separate. So parts of Medicare, the Part A, again, we went over the coverage. A lot of times you don't pay for Part A as long as you've met the work history requirements, which is 40 quarters or 10 years of paying into Medicare tax. Okay. Now, Part A works with any hospital in the country that accepts Medicare, right? There's defined periods. You have a deductible that's 1718, and then once you used up 60 days of lifetime care, then you start to have a daily copay in addition to the deductible. The daily copay is $434 each day. Once you have used up to 90 days, your copay is going to jump up to $838 for the next 60 days, up to 150 days. So again, Original Medicare is going to cover 150 days of lifetime coverage. Okay, it's also going to cover skilled nursing. So the first 20 days that you're in skilled nursing, and remember, skilled nursing stay usually is preceded by 3 inpatient hospital days. Okay, so the first 20 days, you don't pay anything. Days 21 through 100, you have that $217 copay. Days 101 and beyond, you pay all costs because it's no longer a covered service by Medicare. And even if you're on an under 65 plan, most of those plans, whether it's group insurance or individual plans, are going to cover up to 120 lifetime days of skilled nursing. So there's really no plan that's going to cover it in perpetuity. So this is pretty standard. The different parts to Medicare, again, getting into Part B. So costs, right? So costs and out-of-pocket costs. So the monthly cost is $202.90. They'll base that premium off your adjusted gross income from 2 years prior. Okay, so if you're over a certain amount, you could face a surcharge. You might have to pay a higher premium, but the standard premium is that $202.90. Okay, the way the coverage works, there's a standard Part B deductible that's $283. Okay, and then once you meet this $283, so let's say you go to the doctor, you don't pay anything right then and there at the time of service. You then get a bill in the mail for the Medicare allowed amount. Let's say it's $80. Let's say you have enough visits to hit that $283 annual deductible. Then Medicare is going to pay 80%, and you're going to pay the other 20% if you just had Original Medicare. Okay, a lot of times people ask about this excess charge, right? So excess charges, that's if you go to a doctor that does not accept assignment, does not accept Original Medicare, they can bill in excess of 15% of what Medicare would have paid them. So let's say Medicare pays them $100, they could bill $115. We'll get into doctors and accepting Medicare shortly. There's very, very few doctors that do not accept Medicare. I believe this statistic is 1.2%, which we'll touch on here. Okay, so let's say this is your path here. You want to get Original Medicare, and you want to get a Medicare supplemental plan. Now, again, it is important to remember, like we discussed, Medicare supplemental plans do not cover prescription drug coverage. But again, you can get that from an insurance company that offers standalone Part D coverage. Okay. So with a Medicare supplement, again, you have to have Part A and B. So you're going to be paying that premium for Part B separately from original Medicare. Okay. We talked about the drug coverage. The rates are going to go up over time with Medicare supplements, right? So I always tell people you don't want to just choose the cheapest plan. You typically want to choose an insurer that has a lot of insured people and that also has a stable rate history, that they've kind of had a long track record in that particular state. Okay. Because when a new insurance company comes in, they're always going to charge the lowest rate, right? Because once they hit their enrollment number, then you'll start to see those rates go up substantially year over year if it's a carrier that doesn't have a large risk pool to spread that risk across. Okay, so again, Medicare supplements, Medicare is a primary payer, so you don't have to say, hey, to your doctor, do you take Blue Cross? Do you take Aetna, right? As long as they take Medicare, the supplemental plan is going to pay. So you don't have, there's no network, right? All the plans are standardized. So there's letters. So every carrier that offers Plan G, it's the exact same coverage. Every carrier that offers Plan N is the exact same coverage. When you first get on to original Medicare, right, you have a 6 months of open enrollment for a Medicare supplement where there's no health questions, right? So it's 3 months before, the month of your birthday, and 3 months after. That's your Medicare open enrollment period where you don't have to answer health questions. Okay, so some differences here between different Medicare supplemental plans. So we're going to focus on Plan G and we're going to focus on Plan N. Okay. Now the Plan G, there's no cost here after the deductible. The deductible next year is $283. I mean, this is $257, but again, there's no cost after your deductible. So you just have that annual deductible. Then when you go to the doctor, if you satisfied your deductible, there's no out-of-pocket costs, right? The other thing with Plan G is the Plan G will cover the excess charges, right? So excess charges, again, that's if you went to a doctor that didn't take Medicare, they could bill up to 15%. Again, this is quite rare. So we're not going to worry too much about the excess charges, okay? And we'll touch on that too. So Plan N, this is the other most popular supplemental plan option. So with Plan N, you have that annual deductible, right? And then after you satisfy this deductible, you pay up to $20 at the doctor, $50 at the ER. So when you hear this phrase up to $20, what that means is you pay 20% or $20, whichever is lower. So doctors bill off of different levels of complexity with original Medicare. So if the bill, so let's say it's a low complexity visit, maybe you end up paying $12 as opposed to 20, right? But 20 is the most. That's what's important to remember. Now, getting back to this excess charges, there is, this, you might hear this acronym MOMS law, Medicare overcharge measure. There's 8 states, right, which cannot bill excess. So those are these northeastern states here, Minnesota, Midwestern state, but the rest, Connecticut, Mass, Ohio, PA, Rhode Island, and Vermont. Okay, so they cannot bill excess in those states. Okay, now again, not a lot of difference between N and G, just up to the $20 after that deductible. Okay, you can do a quick search on Medicare.gov and you can see all the providers that take Medicare. You can see if your providers take Medicare. It's very likely that they do. Again, the statistic of providers that do not participate with original Medicare is 1.2%. You'll see, read the fine print, it says doesn't include pediatricians. Well, obviously you're not seeing a pediatrician if you're on Medicare, right? So let's look at a example here, actually. Okay. So we can look at cost savings over time. Let's look at you can see our Part B premium, our Part B deductible. Now, let's say we take just a male turning 65, difference between G and N, you can see here $43 a month. These cost increases here, this is based off a CSG actuarial model, right? You can see a rate history, 2018 to 2022, you can see what it actually was, right? So plan G was 5%, plan N 3.6. Now, I will say this increase last year, in 2020, let's say 2025, it's been around like 8%, 8 to 10%, even higher, depending on which carrier we're talking about. So the difference has still been pretty stable, the difference in rate increase as a function of a variable between N and G. That's, about 2%. This is 1.5%, the difference we'll be putting in here. Start age at 65, end age at 80, right? So in this is if we have 4 doctor's visits, 2 primary, 2 specialist visits over the course of the year, an ER visit. So that's $130 in out-of-pocket costs. That gets factored into the savings here. So you have your premium difference, and then you have the out-of-pocket exposure. So you're seeing it's quite a significant savings, right? But even if we have a lot of visits, let's say we go to the doctor 2 times, let's say we go to the specialist 18 times. Well, it's the same $20. So it's not necessarily going to matter if I put this at 20 and this at 2 or vice versa. You can see now my savings is $87.53. And that's going to the doctor 20 times a year, right? So it's pretty significant. Okay. This chart here, you can see the first few years, like if I'm going to the doctor 20 times a year, it means very similar, right? You're barely saving any money on plan N, right? But over time, look at how it increases, especially as you get into this later years, because a 1.5%, a 2% difference in rate increases compounded over 10, 15 years is pretty substantial. This delta is only going to grow. So if we put this out to age 85, again, you could see the delta growing over time here. And again, to age 90. Especially if you're making this choice one time, like let's say you're getting onto Medicare, you're getting a Medicare supplement. I mean, you're talking about $27,000 over the course of 25 years. Again, if you sign up for like Plan G, your rates have gone up quite a bit, and now you want to switch to Plan N, you're going to be subject to medical underwriting if you have some significant health concerns, like if you've had cancer, you have a neurological condition, something that is going to be with you the rest of your life. I mean, it's very likely you won't get approved to make the switch. So the first choice is important, right? So, usually if I'm talking to somebody that's very likely this is going to be their only choice, I'll recommend Plan N because of this, because of the long-term savings. And this is a lot of visits. Most people don't go to the doctor this often, right? I mean, maybe 10, I would probably say is the average. So even 10 visits, obviously the savings is more significant than it was at 20, right? But you can see. So we'll put this actual link in the description of the video. So you could play around with these numbers. You could put in different rates based on quotes that you've gotten or quotes, that you're getting on sites or from an agent or whatever. We have a video too, like this assumption here obviously was the Medicare path, you're choosing a Medicare supplement. We have a more distinct description of the difference between Plan G, Plan N, but more so the choice between a supplement and an Advantage plan. That video is up here as well, if you want to check that out. Okay, and like I said, we'll put this in a link in the description.